so there's three things that we're looking for with the single leg stance stability screen. So the first thing we'll look for is, go ahead and bring your hip up. Right, so the one thing we're going to look for is what's her hip range, her active range. So go ahead and bring it back up. We should be able to get this thing pretty close to all the way to her chest. And so she's a little bit limited there. So one, it tells us about the ability to control that active range on the moving limb. Two, it tells us about stability at the core, to be able to stabilize that pelvis in order to prevent it from either anteriorly tilting. So if she were to overextend, right, anteriorly tilt, see how so much more limited that is, because now her femur is essentially running into her pelvis. So she's got poor control there in the front. So if she braces with her abs and then brings it up, right, so we've got a lot more stability there. So that's the second thing we're looking for. The third thing that we look for with this screen, you can kind of face me, is if you is the stability on that stance leg. So her ability to shift over. There is a necessary weight shift over onto that leg, but we shouldn't see a lot of pelvic drop, right? So that would tell us that she's having a difficult time controlling the pelvis, both above and below. So looking at a top-down and bottom-up approach. So, you know, glute med, her pelvis, quadratus lumborum, those all should be kicked on to stabilize that pelvis and prevent a wobble there. If you go back up on your right leg, yep, just like that. The other thing we can look for is the foot. So a lot of times when runners, you'll see a lot of toe clawing or wobbling there, which indicates some lack of stability. So that's a quick diagnostic for, hey, this person lacks some stability, right? So if you come back up one more time, I want to show one more thing with that active range. Is not only is it just the quantitative amount of hip flexion, we should be seeing about 120, but we also want to look at how the quality of that motion, right? So if she's externally rotating, maybe she's impinging a little bit and trying to clear that. So maybe she's lacking a little bit of internal rotation. So we need to look at the whole picture here, and but an ability to stabilize centrally is really going to drive distal mobility. So distal mobility stems from core stability. So looking at how she stands on that right versus left leg. All right?